a very warm welcome to the first virtual meeting of the Health Change Institute. My name is, like you heard, Horst Heitz. SM Connect is an umbrella organization of SME business organizations, a communication and network platform. And the Health Change Institute is our new member, and we are so happy to have you in our network because you're sharing the same ideas and values like us, that you are emphasizing collaboration, that you say we have to work together, we have to build up networks, we have to bring the topics broader, we have to develop a connecting thinking. And I think this is very needed to have this creating resilient, responsible, sustainable healthcare, who is so important in one way technical, one way also economical, but of course always also very political. And I think here to be in the beginning with your journey here is very interesting for us because there are so many topics from other sectors who we can connect. This is artificial intelligence, this is bureaucracy, many things who is also in other sectors. And I'm so glad that Monica, that you started this project, because I think this is the way we have to go. To think not only in a technical way, this is very important, but also to think that we have to invest in this political way to build up networks. And we have 60 minutes now to discuss this. We have very good speakers. Monica, you will introduce them. I want not to stop you too much from the discussion, but I wish you a good success. And I think we will have soon analog meetings also, because webinars are always good to start. It's also to get in touch, but in the end, it's about people. And Monica, you can deal very good with people, and you are very experienced in this sector. So the floor is yours. Thank you so much.
Thank you very much, Horst, for the very kind introductory words. However, I would like to pass on to our esteemed moderator, Eduardo Pisani, who will give an introduction on our behalf and who will moderate the discussion.
Thank you. Thank you so much, Monica. Good afternoon, everyone. My name is Eduardo Pisani. I'm also very happy to welcome everyone to this inaugural webinar of the Healthcare Chain Institute, also known as HCI, that brings together experts from across the healthcare value chain. So in the next hour, we will discuss the critical importance of collaboration across the healthcare value chain, the evolving needs of patients, and the role of all stakeholders, from production to patient care, in accelerating medicine supply and access, and overcoming supply chain stresses and addressing regulatory challenges which we face on a regular basis. As you all know, today's healthcare ecosystem is complex and dynamic at the same time. It involves manufacturers of API, medicines, medical devices. It involves distributors, healthcare providers, regulators, digital service providers as well, and patients, obviously. The effective collaboration amongst all these groups is essential for optimizing processes, reducing costs, and improving patient outcomes. So the agenda today is really aimed at, if we can switch to the next slide, is really aimed at understanding the founder's vision for HCI, learning how you can become a part of the journey, and discovering an innovative approach for a healthier future. Now, you will see that each of the panelists today will address these very straightforward questions on the agenda. What is HCI? What is its added value, priorities, next steps? And I also invite everyone in the audience to ask questions. There is obviously a Q&A button that you will see at the bottom of the screen. So please do not hesitate to intervene during the discussion or at the end of each presentation. Now, the next step is to introduce the founding members of HCI. And if we switch to the next slide, I am very, very pleased to introduce first and foremost Monica Derecpoix, who is the former Director General of the European Association of Healthcare Distributors, GIRP, and former President of EMVO. Let's not forget this European Medicines Verification Organization that was set up on the basis of recent legislation. And she is also the founder and leader of CETAN Ltd. Then we will hear from Charles Glore. Charles has established and led Movianto and is the founding partner of Birgli Ltd. Then next is Andy Richmond. Good afternoon, Andy. Former GM and chair of Pfizer Expert BV and also CEO of WellWeb Limited. Last but not least, Martin Fitzgerald. Good afternoon to you. Also with GIRP as former Deputy Director General and currently Director of Digital Health and Public Policy for Healthcare at GS1. So thank you all for making this happen, first and foremost. And we really look forward to hearing the various steps, the strategy, the vision. So let's start with Monica.
So thank you very much, Eduardo, and thank you to all of the participants for joining us here today on behalf of the Healthcare Chain Institute founding members. I'm really excited to introduce HCI to you, a project close to my heart, as I felt the need for such an initiative of collaboration during my whole working life in the healthcare sector. Our goal is really to improve people care and people well-being while creating a more resilient, efficient, and responsive healthcare system. HCI is supported, and if we can move to the next slide, please, by a group of highly experienced board advisors who bring a wealth of knowledge and expertise from various angles of the healthcare sector to the table. First on the slide, we have Dr. Rafik Bishara. Rafik was former Director of Quality and Knowledge Management at Eli Lilly and is now very active in the PDA, the Parenteral Drug Association. Next to him, you see Henry Ames. Henry is General Manager of Supply Chain Work Management at TraceLink, and Henry also brings a value of knowledge from previous jobs in quality and risk management to the table, and this is also very, very valuable to our efforts. Next, Pauline Schul. Pauline is a pharmacist by education with an MBA, and she's owner of Change for PS and co-founder of HealthBuy. Pauline's specialization in patient services and specialty services is critical as we strive to improve patient outcomes across the healthcare value chain. Eduardo Pisani, our esteemed moderator of today's webinar, did not get the adequate introduction, but Eduardo held many leadership roles in corporations, in trade associations, and non-profit organizations, and Eduardo is really an essential asset to our advisory board. Under Eduardo, you see Olivier Simoneau. He's a staunch advocate for sustainability and diversity. His expertise is in cold chain and supply chain visibility as well as in ESG, and he will guide our efforts in ensuring that all our initiatives are sustainable and efficient. And last not least, on the bottom left, you see Eddie Gillison, the Senior Director of Supplier Alliances at IQVIA and the board member of the African Pharmaceutical Distribution Association. Eddy's experience in consulting data, health economics is equally crucial to our work. And in addition to the board of advisors, we also in the process of finalizing the recruitment for a regulatory advisory board composed of past senior regulators who will equally guide us. If we jump to the next slide, please, we can start with our vision. So at HCI, we envision a future where the healthcare value chain operates as a seamless, sustainable, and digital ecosystem. This ecosystem will not only enhance people care and well-being, but also foster resilience, efficiency, and responsiveness within the healthcare system. Our mission is equally ambitious. We aim to foster collaboration, innovation, and value by bringing together all stakeholders in the healthcare sector. And by uniting these stakeholders in a single platform, we can bridge the existing silos and leverage the opportunities to optimize processes and networks across the entire healthcare chain. If we move to the next slide, please. So why is HCI needed? I already gave a little hint. The healthcare sector is highly fragmented, with stakeholders often operating in silos where these are corporations or associations. And this isolation hinders our ability to address the ever-increasing amount of cross-sectorial challenges, which would require collective action. For example, issues related to patient access, supply chain sustainability, and digital transformation, they cannot be solved in isolation. Moreover, there is a significant lack of understanding about the entire healthcare value chain. This lack of understanding, coupled sometimes with a lack of trust among stakeholders, and also sometimes with a misalignment with policymakers, further increases our challenges. Therefore, the role of HCI is to bring everyone together, foster collaboration, increase the understanding, and build the trust needed to align towards our common goals. Now, next slide, please. To achieve our vision and mission, HCI is structured with a robust governance framework at the core, and all the associations will recognize that as they have very similar setups. We have our board and the General Assembly as statutory bodies, supported by the Secretariat. We'll start off with 3 working groups, which we think are the critical areas. They are patient access and continuous supply, sustainability and ESG, as well as digitalization, and also an innovation platform to have innovations evaluated by the whole healthcare value chain and get feedback from the whole chain. And we also plan to have later on an educational academy. But this is not for immediate, to share knowledge and to provide for continuous learning. If we move on, we were one too fast. We go back, and I would like to hand back to Eduardo.
Thanks a million, Monica. I see that there is a question, and there was already another question which arrived through the chat. So perhaps, Monica, the questions are both really complementary to one another. The first one is related to the engagement of HCI with policymakers in order to ensure alignment between healthcare regulations and industry practices. Now, based or following that, there is also a question from, on the Q&A that relates to the collaboration that HCI would have with other best practice bodies which have similar or complementary agendas. So in both cases, it's about engagement and collaboration, policymakers, other bodies. What's your take?
Both are very good questions. On one side, we think that there must be at close collaboration with policymakers. And that is why we have set up this regulatory advisory board in order during our work already get feedback from policymakers who have experienced policy making throughout their working life. It will take longer than in a vertical trade association to come to recommendations and policy asks. But once we manage to get there, they will be very powerful, as it is the whole healthcare sector which is behind these asks and these recommendations. To the second part of the question, we do not intend to reinvent the wheel. So what we want is to really integrate everything what is out there and just bring it together, pull it together, and move on with what was already done. So we are reaching out to all different initiatives, at least of those we are aware of, and we try to align and find the synergies in order to work together.
So conversely, it's also an invitation to all the participants and also to those who ask these kind of questions to contact HCI in order to be part of the initiative and be part of the effort.
Exactly.
Let's move on. Charles.
Right. Well, I think the questions and the previous topics really dovetail directly into it. If we can go to the next slide, I believe. Next one after this. There we go. So Monica mentioned earlier talking about bridging silos. And again, we don't want to reinvent the wheel. But what we've noticed is that today, things are working more or less like the different stakeholders, which I've shown here as different buildings, if you like, with bridges going between them, that they're actually parts of a puzzle, if you want. So each piece carries its own data and information, but they don't always communicate with each other. So where in this industry body probably should communicate with a service provider, for example, or with a regulator, sometimes those messages are not that clear. So the target is to try to bridge silos, and that's an important term. We're not trying to break silos. Silos are important, actually. We're trying to bridge them, and there's a big differentiation between them. So coming back in terms of how we would add value, what we're trying to do is actually to look for a common language between the different silos today, between the different associations, and from there we can build alignment on key topics. And that's a critical piece. So we're actually working to try to engage with everybody and have, if you want, cross stakeholder communication beyond what we currently have today. And this is really quite important because a lot of us are going to regulators or to different areas without talking with everyone else or understanding what else may be happening out there to some extent. And so the way that we're going to do this was alluded to, and if we could go to the next slide, is by setting up these three primary working groups, being ESG, digitalization, and patient access. And I think this is what we want to emphasize here is that this is the initial working groups that we've come up with. And within each working group, we would have work streams that would be driven by the different working groups. And what's really important here is that these working groups will be driven by our members. So that would be you, that would be the key stakeholders coming in, which would be coming from the different silos. So they would actually be working together and collaborating together to try to address key problems that the working groups would come up with. So some of these things are carbon footprint calculations, for example, interoperability on the digitalization side, or market access, so ensuring that patients have access to the right medicines and that it's safe for them at the end of the day. And all of this would be underpinned by an innovation platform that would try to seek to not only work between the silos, but also between the working groups, because obviously they need to talk to each other as well, because they're all working together to achieve the same goal, which is ultimately, if you want, better outcomes for patients. And we'd have to actually, during some previous discussions, move beyond the word patient, but actually to the individual, because obviously if we work earlier from the perspective of interventions, if we can talk about prevention, that's before someone becomes a patient. So that's also an important concept behind that. So again, you'll be asking the question, well, how are you going to do this? What makes you different from the other associations that are out there? And I think the next slide will help us guide you into that direction. So the first thing that we'll do first as a whole within HCI and then by working group is to develop a common framework. And Eduardo mentioned, and Monica as well, that in some cases there's a reluctance to share data. And so we need to identify which areas our members, our stakeholders, and all the stakeholders that will join, which areas that they would actually be prepared to share information, and from there develop a common framework from which we can actually address and develop recommendations to go forward to address the different areas that come up in the out of the different working groups. And with the common work framework within each work group, we can actually then develop the work streams. And then again, using that framework, we can prioritize and from there develop recommendations. And with a framework that also builds an element of governance and consistency. So we can actually look back and understand, why did the working group come up with this particular answer or this work stream? We can actually go back and look at how that was happened. And from there, we would hope that the clear priorities and recommendations that come out of the work streams will be disseminated across all of the silos, if you like, or across all of the stakeholders, so that when we are talking with our relevant stakeholders, whether those are our going downstream to our customer or patient communities, or upstream to the regulators, that we're actually speaking the same language. Now, that doesn't mean we necessarily agree on everything in terms of policy or outcomes, but at least we're speaking in the same language. And that's very, very important, because I think today, when people are talking with regulators, for example, going to the EMA, for example, or others, often the same words are used, but with a very different context and meanings. And from there, by including members across the stakeholders, one set of recommendations, if you want, can be looked at across the entire work stream, or all of the different work groups that will be developed. And again, the important thing here is that the work groups and the work streams will come from our members. So we've proposed an initial framework to go forward, but at this early stage, we're quite flexible in terms of developing that. And with that, I think I'll hand it back over to Eduardo, and of course, any questions that might come out.
Sure. Thanks a million, Charles. That's very helpful. And actually, you have addressed already one of the critical points, which is how to ensure effective collaboration amongst stakeholders, which are diverse in terms of their maybe their origin, and also in terms of objectives that they have in the short term, at least. So if you have additional thoughts on these, please go ahead. I have another couple of points, though, which are coming up on the Q&A. One has got to do with distribution of essential medicines in low and middle income countries. So is there an ambition also to look at other geographies beyond Europe or beyond North America, etc., as far as the work of HCI is concerned? Is it going to be transferable to some extent? The other question, which I reserve also for maybe for Andy in a minute, has got to do with overcoming challenges related to security implications of breaking down data silos. This is also a very important dimension, which probably we want to address in detail in a moment. Let me go first to Charles.
Okay, well, and Monica, please do step in. But from a regional perspective, I think simply from the perspective of being realistic, we would probably start with Europe, but the broader Europe, which includes as well countries with different economies and different states of the economy, as well as different healthcare systems for that matter. So that would be the initial focus, but we do have the intention to expand that beyond Europe, and the speed of that will depend on our members at the end of the day. So we will be dependent to some extent in terms of the members that join us and their own roles and their own functions within their organizations. And I think that's also an important piece, is that we're looking for people that can actually come back to their stakeholders, to the relevant silos, and actually drive the changes and the discussions and to communicate, if you want, the common language that we're trying to work on, as well as recommendations and priorities. I don't know if that answered the question well enough, Eduardo.
You're very clear. These are questions which are very complex, and therefore it's also important to summarize them at this stage, but clearly they will deserve much more attention in the next future. Let's move on, and Martin can jump in the discussion and address some of the sustainability questions that HCI is going to address, as illustrated by Charles earlier, and perhaps also make reference to the digitization aspects. There are already questions that have got to do with the sustainability dimension. So, Martin, tell us what you think.
So thank you very much, Eduardo, for offering me the chance to address a little bit of the work that is envisioned in the HCI across the different working groups. Indeed, like Monica mentioned and the other founders, it's a pleasure to be involved in this initiative. It has been a long-term vision, but it's a vision which we have come up with some preconceived thoughts at our side, but in consultation with potential stakeholders that would be involved in the HCI. And as Charles alluded to, these are initial thinkings. These are initial ideas of the different work streams or working groups or platform areas where the work can commence, but they're not, the list is not exhaustive. The list is also not completely fixed, but are very reflective of some of the issues that we've been hearing on a reoccurring basis, and which are interconnected across the healthcare chain and important, where not each individual operator or issue existing in a silo can be solved alone. So if we look at sustainability, it is a working group where there is a need for cross-sector collaboration. The working group would or could look at some of the common interconnected and reoccurring issues that have been heard in the healthcare chain and which cannot be solved, as I said, by a single silo or by a single operator alone. And without going through the slide in any great detail, I'll take just one or two examples, but everybody will recognize what's on these slides. Everybody will recognize the issue. But if you take in particular, in the context of scope 3 emissions, any group that needs to calculate their scope 3 emission cannot do so alone. So the idea is to come together, to discuss, to see, to recommend ways in which you can leverage existing or develop or implement current recommendations or develop new ones to accurately approach, develop measures and share information on carbon emissions across the healthcare chain, so that each one can take their responsibilities, their liabilities for this, and come to a conclusion which meets many of the new ambitions in both the policy, political, and regulatory field. You touched upon the issue of new regulations, of having the regulators involved. Today, many stakeholders will look at the impact of these regulations or new legislation in silo, but perhaps do not consider the extent of the impact across the healthcare chain as a whole. So by coming together, providing that platform, each one can contribute to an overall recommendation of how a particular measure will impact their operation and reach the end goal of satisfying each one's individual responsibilities. You could also look at it from a technological perspective. There is, and this again links in, not every, like the healthcare chain, not all of these working groups will exist in a silo. So if we're looking at issues related technology within the environmental sustainability working group, it may touch upon digitalization. So the whole idea is to look at the cross-fertilization between the stakeholders, but also the issue areas which we're addressing, and to develop, for example, recommendations around optimization of delivery routes when you're moving goods, reducing inefficiencies by creating more standardized packaging or volume of materials and so on, that you can optimize the transport vehicles to ensure reduced carbon footprint for each particular operator, and of course the healthcare chain as a whole. And again, it continues across the circular economy, looking at issues such as how to reuse, recycle, and the responsible disposal of healthcare products and materials, which again feed into sustainability as one of the key areas of the healthcare chain initially. But the whole idea, as Charles already alluded to, is to deliver recommendations. It is to bridge those existing silos. It's to have the communication line between the different silos, not to break them, to speak more or less the same language, and come to recommendations. So the encouragement is anyone, an organization that is facing sustainability issues today, is to come to the table, come to the group, and to discuss together. Likewise, with digitalization, the working group will focus on a number of key pillars, which are presented on the next slide. You will see some of the typical pillars when you talk about digitalization in the healthcare supply chain, such as interoperability, transparency, visibility, and data security that was already mentioned. And some of the key thinking here is to really encourage partnerships between the healthcare chain industries and stakeholders, and to leverage existing and new technologies to achieve some of the shared goals. Again, linking to some of the other working groups would be in the area of sustainability, operational efficiency, and patient accesses, which is one of the next working groups. Identifying areas to work in the area of the regulatory environment and data protection that hinder digitalization is something which such a group could look at. Promoting policies that drive digital transformation and maintain security of data and privacy, not only the security and privacy of business data, but also that of personal data. And of course, there is a regulatory framework in many jurisdictions that support the protection of patient data, for example, but there are many ways in which to implement and drive that forward, and that needs to be looked at together. Not any individual stakeholder or operator can achieve that. And as we are talking or being hosted by an organization promoting small and medium-sized enterprises, we can also look at ways in which such a group can support such organizations which are smaller and maybe lack the capacities to tackle some of these cross-cutting issues alone. So the group HCI may be able to find and support with resources and guidance, or even access to some digitalization tools. So as you can see, the list is not endless. It's rather there are many areas which may not be covered in this. So again, the idea is to provide that platform so that everybody can come together and decide on the relevant priorities for each of the different work streams, whether it's the sustainability one I already mentioned, whether it's the digitalization one that we're just looking at, or whether it's on the patient access one, which is coming right next. And if we have the possibility to jump to the next slide, that would be great. I think we have to go on more if I have not. But I hope you can see the correct slide. So the other third work stream is on patient access and continuous supply. We all know that we need to put the patient first and foremost. Everybody in the healthcare chain is working for the ultimate benefit of the patient. So by working together, whether it's on medicines availabilities, on shortages, finding ways to mitigate shortages and to ensure long-term viability and security of supply, to patient advocacy and access programs, right from the very beginning, from once the product is produced or even before, to once it reaches the patients. These are issues which should be discussed or can be discussed in a working group on patient access. Whether that could include value-based pricing, for example, and reimbursement. So it's not only about getting the product accessing the product on the market and deciding a price or deciding how it's reimbursed, but also the physical distribution of that product, looking at the most optimized ways to do so by working together, understanding each other's needs, constraints, and opportunities is an area of potential flourishment within the group. Looking at issues with distribution, safety of supply, anti-counterfeiting, to regulatory compliance and monitoring, and to looking at emerging technologies, new products, so on and so forth. All of the issues which we have identified in discussions with people who share the vision for a HCI have identified. But once again, this is just some initial thinking based on the vision of the founders, but also from some early discussions with future and hopeful potential members of the HCI, so that altogether we can drive forward the vision and mission that Monica presented at the beginning of the Institute. So it's a pleasure to be able to present some of these key priorities across the different working groups to you all today. And I'm very much looking forward to, in my job here at GS1 Global Office, responsible for digital health and public policy, I see a lot of my day work can feed into the vision and mission of the HCI, and it's a real pleasure to work with the founders and indeed the advisory board, and look forward to the HCI becoming a big and broad family in the coming weeks and months. So join up, and on to Andy, back to you, sorry, to Eduardo, and then I guess Andy. So thank you, Eduardo.
Thanks a lot, Martin. You've actually covered a lot of ground, and therefore you can take a breath now, and we can perhaps touch on one of the many questions which are coming through the quick Q&A, and one which is really essential, let's say, to everything that has been presented so far before moving to Andy. Are there, maybe the question can go to Charles or to Monica or anyone else who wants to answer. Are there any examples of misalignment or misunderstanding that HCI can help fix, and which have not already been addressed in recent times or by existing platforms, organizations, etc.? I think this is, a sort of consequential type of consideration based on everything that has been said so far, and then we move on to Andy, unless Andy, you...
If I may, Eduardo, can I take that question first? And
sure,
then maybe somebody else would like to contribute as well. I'll give two very simple examples, I think, of where we can uniquely provide end-to-end vision and policy input. One of them, actually, Martin's already talked about, which is in the ESG space. And let's talk specifically about carbon footprint. Now, there's a huge amount of effort that's taking place with manufacturers, with logistics providers, with repackagers, etc. But effectively, they are all working within the silos that Charles described earlier before. And I'm really passionate about this because I've seen both sides of the equation. I've seen the manufacturer side of the equation, and I've seen the wholesaler side of the equation. If you look at where we are now in that process, there's been a huge amount of effort trying to standardize the measurement of the as-is model. The reality is there are two levers that nobody really is addressing at the end-to-end level that really need to be managed. Number one is, who can afford for fleets to be restructured in the model that we've got today in Europe? There's a huge capital outlay there to do that. Secondly, and probably most importantly, who can move first? And by that, I mean, very simply, if we were to harmonize service levels to purchasing pharmacies and perhaps have a different commercial relationship with pharmacies as a consequence, everybody could achieve a step reduction in their carbon emissions. But the way the model's generated today, nobody can unilaterally make those type of changes because there are too many competitive risks out there. And I know for a fact that manufacturers would really like to look at this. I also know that wholesalers and logistics providers would really like to look at this. The only way that it can be solutioned is if we're all talking about it, really understanding the context, the interdependencies, and the shared risks, and moving forward with a single solution wherever one is possible. So that's one very concrete example. I think the other is also an area where there's been a tremendous amount of energy over the last few years, and that's about actual demand triggers and demand management of medicine supply. And what's happening at the moment is there's a lot of policy, legal, and lobbying activity taking place. This is what I think, this is what I think, and let's meet in the middle and have an argument about it. And nobody walks away particularly satisfied. What isn't being looked at is the operational reality, again, from an end-to-end perspective. How could better cooperation between data providers, between manufacturers, between logistics and service providers create a much more seamless approach to true market demand and customer access to medicines? So they would be two. There are many others, but those are two rather big ones that I think are worth flagging at this stage.
Thank you very much, Andy. And before you continue and close the round of presentations of all the founding members, actually, it seems to me that what you're saying is that the HCI is going to fill a very important space, a gap, which does not exist yet, which is, I mean, a coalition or a platform rather, that does not exist yet, and which aims ambitiously at bringing together all the different experts who would otherwise maybe unilaterally try and address issues without taking account of the repercussions, consequences, or even not maximizing the opportunities which may exist, whether in environmental matters, regulatory, digital, etc. So yeah.
I was just going to say, Edward, it's bringing the debate and the sharing of ideas and context. That's what we're doing here. And as a consequence of that, having a safe space for all partners to really talk about what they want to achieve, how they want to achieve it, and most importantly, to have one vision of the patient or the citizen in that thinking. That doesn't exist anywhere today. And segue into my slide in a moment, we are seeing more complexity now than we have ever seen, certainly in the 30 years I've been working in the industry. And 30 years ago, maybe I may have made a unilateral move in some of these areas because I could afford it. The margins were there. My business was buoyant. As margins are decreasing, complexity is increasing. We need better coordination. And that's why I think the time is absolutely right for HCI to come in and to provide that safe space to really understand consequence, context, and risk.
Thanks a lot. And this, by the way, is, I think, also connected with one other point which is submitted by Alan in the Q&A, which has got to do with supply chain disruptions, which have recently taken place, and therefore resilience in the supply chain is all the more important, indispensable, and I would argue, to your point, it requires the support and the contribution, the inputs from different stakeholders. Let's please move ahead, and then we keep picking from the Q&A. Andy?
Super, thank you, Eduardo. So can we move back to the slides, please? This is it. So this does talk about what we've just been talking about to a certain extent. I'm not going to drain the slide, but I do want to sort of break it down a little bit. As I've just said, over the last 10, 15 years, the complexity that all of us are facing has increased significantly. And that has been exacerbated by things like the recent pandemic, by trade tensions, by physical blockages in the Suez Canal, and also with payers' ability to pay for the life-enhancing medicines and wellness contributors that they need. So we do have some operational complexities. So we talked about supply there, whether it be API sourcing, whether it be changing expectations in the market. critical medicines now have got far more of a focus on them than they did 5 years ago, quite rightly. We know that the pricing and access area has become far more of a gamble than it ever used to be because of payers' ability or inability to pay. The hurdles are getting ever higher to innovation entering the market. And there is a lottery element. Can some markets, can some regions, can some cities and areas afford to pay as budgets have devolved down to local level in many cases? There's then also all of the processes that sit around our operations, whether they be physical processes, whether they be data processes and standards. We work on a very fragmented systems landscape, which previously extrapolated and time not sensitive data has been okay for. But now that the political pressures are coming on, the patient expectations are increasing, it's very difficult to work across a fragmented systems landscape with limited interoperability and limited data insight. And we really need to try and break some of those barriers down and understand under what conditions and to what endpoints can better collaboration help patient supply. But outside of those operational complexities, I would also argue that there are some positive complexities, and that's around innovation. The move towards AI, towards intelligent supply, towards personalization of healthcare and wellness, initiatives like the EU data space, which is going to provide opportunity for more insight, but do we really understand how to use that insight and what it's going to drive in terms of practical endpoints? And my argument is, as I say, 30 years ago, a local P&L holder, a local P&L manager of a company might have taken a punt on some of these opportunities, but the complexity now is so significant that it's now time for everybody to try to understand how the handoff points and the bottlenecks within the supply chain can be better managed. We don't have true end-to-end capabilities in the value chain today. We don't have the right level of cooperation, and we certainly don't have the ability to understand and take actions on risk and risk sharing. And that's where new thinking is required. We all know that patient expectations have increased post-pandemic. We all know that the supply chain is under more pressure than it ever has been before. My argument is that it's now up to us as leaders to come together, to understand what mutuality and cooperation can achieve, to do so without compromising confidentiality and commercial confidentiality. That's very clear. But there are practical things that we can do, and we can do collectively for the benefits of patients, and we must do those. Can we move on to the next slide, please? So in terms of benefits of membership, again, I could drain this slide, but I'm not going to. I think the number one benefit of membership is that you will be joining people who've got proximity to your operation and have got different insights and different perspectives on how the supply chain and value chain for medicines works. By creating that space for us to interact, to talk, to be safely able to talk about our operational pressures and our business visions is going to be to the benefit of patients wherever we operate in Europe or global. That network will be trusted. It will cover the whole value chain. So manufacturers, logistics, services, regulatory, quality, legal, etc. We will aim where we can to create one vision, one goal approaches. And as Charles has said, there are going to be areas that we can't agree on, but we have a much better alignment on what we take to the table as a consequence of sitting down and working this through. You will, of course, be able to contribute to the shaping of the future, which is critical, bringing your organization's perspective, but also bringing your own expertise to the table. There will be many solutions sitting on this call today that have not had an avenue to express themselves previously, and we really want to facilitate that. Obviously, we'll be sharing relevant intelligence. We'll be having regular events, work streams and the like. But everything that we do will be focused on a patient-centric approach and getting more medicines to more patients more often. If we can move to the next slide, please. And I'm going to take this really simply. As a consequence of today's meeting, you will, of course, get a copy of the slides that we do. You will also get information on how to join. You can join on our website. You can see us on the web or via our LinkedIn page. The important thing is that we gather membership now from corporations, from service providers, from associations. But more importantly, as we've discussed, we've got ambitious plans in these work streams, and we need SMEs, people with expertise, with operational insight and capability to actually take a practical view. We don't want to be a talking shop. We want to be a driver of true operational and customer-centric change. So please join us today or as soon as possible. And with that, I want to thank you on behalf of all 4 of us founders and from our advisory board. And I'm going to pass back to Eduardo, hopefully to maybe take a few more questions and close the meeting.
Thank you very much, Andy. There are several questions which are coming up, and I am trying to extract some of the buzzwords, the keywords rather, because clearly the thematic areas that have been illustrated today, and this is clear, I'm sure, to the audience, are complex and are quite broad, whether we talk about digitalization, whether we talk about sustainability matters and access, market access, patient access. So let me extract quickly 3 points, and anyone who wants to answer, please feel free to chime in the conversation. First, HCI, is it going to lead and be a flag bearer to repeat exactly what's written in the question for greater standardization and enhanced harmonization, especially with regard to good distribution practice? That's one. Then I prepare also the second item, which has got to do with digitization and several aspects related to patient data, which are then useful to enable complaints, pharmacovigilance, etc. Perhaps the question that I would frame in this context is, what are the specific priorities that are envisaged in the working group related to digitization, so that we try to focus a bit more instead of expanding too much the discussion. Who wants to take the first question on standardization? Charles, please.
Yeah, I think that's actually a really good question, and it's an important one. So at the end of the day, we won't be the flag bearer necessarily. We are the facilitator. So we're there to work with our stakeholders and our members to develop the message. And we would, from a GDP perspective, we expect that some of our members will be experts in GDP, and they would contribute to topics that might be related to that. And we will try to then build a common language and alignment between all of the stakeholders around those topics. So I think that's a really important point. So we would join them in terms of waving the flag, if you like, but we're more of a facilitator behind it to ensure that everyone's speaking the same language. So I hope that's a clear enough answer to that question.
Thank you. So facilitators is the buzzword that we should remember. Regarding the working group on digitization, is there anyone? Yes.
I'll take that, Eduardo, and I'll link in the question that you raised before about security as well. I don't know if we're able to go back to slide 14, but if not, I can talk it through anyway. So there are 3 main areas that we're going to concentrate on. Back, I think it's either 1 or 2 slides from this one. If we go back one more. This is it, yeah. So 3 areas that we want to look at in the first year. We will obviously get much more operational and innovative as we get this right, but we want to be able to standardize the approach wherever we can for the benefit of simplification and for patient-centric supply. So first focus area will be interoperability, and we really want to try to create visibilities there. So what we need to understand is, under what condition can data be shared, for what purpose, what is the end point, and what are the relative risks and benefits of our various stakeholders of cooperating more in these areas. There are obviously a number of initiatives that are out there at the moment, not least of which the European Data Space Initiative, but we can do more with today's operation than we currently can, and that's what we want to get there. The second is around true visibility and transparency, and that's largely to do with, once you've got the data, how do we adopt practices that are positive and change the way that we do things? How do we make sure that we get conformity of traceability, for instance? Can we move to better adoption and more industrialized adoption of single solutions and endpoints? So we're not designing these. What we want to do is facilitate those active projects on a broader canvas, and we want to understand how we can accelerate it where certain individuals or groups or nodes in the supply chain are struggling, and we want to be able to help them to get there to the endpoint quicker. And the third one, of course, is security and controls. And there's a whole raft of considerations that we're going to need to get through with that. Who gets access to data? And how close do we get collectively to the patient, which is something obviously that we're institutionalized, not really to get insight into. How do we make sure that patients are not compromised, but that the service levels that face customers are better, and that more medicines can get to them in a safe, repeatable, compliant, and secure way? The downside of interoperability and visibility, of course, is that data could be existing in multiple locations, and that always compromises security. So part of this will be to try to understand, are there some areas where perhaps centralization of some of this data is useful? Do we actually want to create the ability to see the data, or do we want to train algorithms on the data so that we can get outcomes that have got good security involved with them? It's this type of thinking that we're going to need to work through. We'll do it collectively, but a lot of it is about establishing the playing field, and then once that playing field is established, we can get really innovative about personalization in healthcare, intelligent supply, etc., etc.
Thank you. Andy, thanks a lot. This has covered many of the points that were raised. Perhaps since we're close to the hour, this is my last question, again, general, and at the same time, repeating that the geographical scope will be prioritized, I believe. Perhaps, Monica, you want to have a final 30 seconds on this? And
Okay,
then
I will be very brief. The geographical scope is global, but we said as manufacturers operate globally, but most of our contacts are in Europe. So we will start with looking at the European aspects, but there is also ambitions for Africa. I think one of the questions went in this direction. We have two members of our advisory board from the US, so we will not really close it up, but we will start to roll it out from Europe.
Excellent. So it's really time for me to say thank you to all the participants, to all the panelists today. Thank you, the founding members of HCI. It's been a very dynamic discussion, very lively. It is clear that the agenda of healthcare policy in the next decades is really based on all the issues that have been addressed today. It's clear also that the complexity of bringing everyone together requires an effort, and the HCI is ready to make this type of effort. So again, thanks a million, everyone. Keep in touch, and I leave the final words to Horst and Emilia.
Thank you so much. It was very interesting, and I see how complex, and also that the discussions are specific here, but also not so new in the other sectors, because we discussed this also. You have to think more complex. There is not easy solutions. And I think this approach is what we need for a sustainable healthcare policy. And I wish you good luck. And we get, of course, also the link, Martin, what you give us to SMEs. I think there we can support you in many ways, because artificial intelligence, other points you mentioned, they have the same challenges, also the green transformation and so on, and we can learn from each other, and we can also do a strong position together. Because if you're out of the box, you are not a minority. It's health is fundamental, but sometimes if you're a small stakeholder group of experts, you are also a minority, and then you have also to say, where is then the political value in the debate? And so better you are connected, so more you can say how the problems are the same, so better you can raise the voice. And Monica, congratulations for this initiative, for this institute. And you can count on us all the time, because also the past worked very well together. And if we can help, and also not only in Brussels, also we're coming to different places, to the SMEs, to the companies where they are sitting, and that we also involve the member states in the discussion. I think this is also a very important dimension, not only to see the European focus, that we have also standardizations, that we have really also an approach who is, I think is cohesive. This is, I think, very important. And yeah, thank you so much.